welcome everybody, and to make sure that we have enough time to hear from our speakers and to get our questions answered, I'm going to get started. My name is Aaron Nelson. I'm the president of the Chamber for Greater Chapel Hill Carrboro, and we are very glad to have you here. Your Chamber of Commerce is a network of about 600 businesses and nonprofits throughout our region, employing about 90,000 folks in the Orange, Durham, Wake, Chatham, Alamance community. Our commitment to you, we have a customer promise. That's to connect you, to advocate for you, and to help drive progress and build community. Today's conversation is in service of that promise of connecting. One of our key goals is how do we connect you with the people and the information and the resources that you need in order to be successful. And after almost 2 years of this, we feel that we're pretty good at this, all of us collectively, right? Tracking information, paying attention to the changing rules and regulations, expectations, masking, etc. But we wanted to call this meeting because something different seems to be happening. And we wanted to give you direct access to the key experts to make sure that you get your questions answered. We can hear a little bit about what's going on right now and to hear about what we can expect going forward in the future. Our meeting is going to be divided into 2 segments. First, I'm going to introduce our local experts. They will each speak for about 12 to 15 minutes from their vantage point about what they see. I may ask them a few questions. Our second segment is when we're going to turn it to you. So you are muted at the moment. We encourage you to type your questions in as we go. We say to our 2 speakers, we do not expect you or even want you to keep up with those questions. Just keep going with your presentation. We'll track them as your chamber staff and ask them to you when you finish sharing your information. But to those on this call, you may both ask in the chat throughout at any time, or you can raise your hand and we will call on you and you can ask them directly. So we're open for 20, 25 minutes of that. We are recording today's conversation. We will share it throughout the chamber network. We've had many folks request access to this information. All right. So let's get started. Our first speaker is the Orange County Health Director, Quintana Stewart. Director Stewart has served the Orange County Health Department since December of 2017. Prior to arriving in Orange County, Director Stewart was the Public Health Preparedness Coordinator in Forsyth County, where, among other things, she was responsible for coordinating the response to the H1N1 swine flu outbreak. She has a degree in public health education, a master's degree in public administration, where she had a concentration in healthcare administration. Recently, she was recognized for her exceptional leadership during these times of pandemic by the Chamber of Commerce. The 2021 Duke Energy Citizenship and Service Award. Director Stewart, we were very pleased to give that to you, which is one of the highest honors that we have as a business community. And your leadership in these tremendous times has been nothing short of exceptional. Our second speaker after Director Stewart is going to be Dr. Abhi Mehrotra. Dr. Mehrotra is the medical director of the emergency department at UNC Health's Hillsborough Hospital. He is the assistant medical director at UNC Health Hospital in Chapel Hill. He is the vice chair for strategic initiatives and operations at the UNC Health's Department of Emergency Medicine. And he's also a clinical professor in the School of Medicine, a father of two, and because he outperforms, he also has his MBA from UNC Chapel Hill. Has been in our community where he did his residency, and then a decade later went on to get his MBA. So he's been here since the year 2000. So let's begin first with Orange County Health Director Quintana Stewart. And what we've asked her to talk to us a little bit about is local COVID infection rates, vaccination and testing availability, and then again to answer our questions. So welcome, Director Stewart.
Good afternoon. Thank you for the lovely introduction, Aaron. And thank you all for inviting and having me today. So I do have a slide deck, and let's see if this. So can you all see the slides?
We can, looks great.
All righty. So I'll just jump right in. And as Aaron said, I'm going to just kind of give you the outlook on what COVID looks like here for us in Orange County currently at this time. Okay. I'm sorry, I'm trying to figure out my menu here so I can still see my slides as I talk. So I'm sure everybody is well aware of the surge in cases that we are currently experiencing throughout the county, throughout the state, throughout the country, actually. So here in Orange County, our transmission rate, we are sitting at high, as is every county across the state. So if you've been keeping up with the CDC community transmission map, you will notice every county in North Carolina is red. That's in the high transmission rate. So again, that number is determined by your case rate per 100,000 individuals over the last 7 days. And for us, as of today, our case rate is now at 1,182 cases per 100,000 over the last 7 days. So we are in record highs here and have been for several days now. So in Orange County, our number of cases this is just straight cases, not the per 100,000, but the number of new cases that we've seen over the last 7 days, 1,755. I never imagined I would see a number that high for Orange County. We were, panicking when we would see 35, 40 cases a day, and now we're well over 1,000. Over the last 14 days, we've seen 3,001 new cases. Our percent positive is at 19%. For those that have been following us, since the beginning, you know our goal across the whole state, our goal is 5% or less. So we are far exceeding that goal of 5% or less. We're at 19%, and the state is also far exceeding that, and they're now at 30.5%. Now, I didn't look at the map today to kind of gauge how we're doing in comparison, but I can tell by the colors, and I would say, and this is still not great, but in comparison to some of our surrounding counties, our percent positive still tends to be a little bit lower. To date, we now have a total of 113 deaths in the county. But what I want to point out is that while one death is one death too many, right, to lose anybody to COVID, but we are not seeing a high increase in our death rate. And let me knock on wood, I don't want to jinx it. Here in Orange County, we stayed at 110 deaths for several months. I want to say like early February up until maybe the fall. We didn't see additional new deaths. And so we just saw some movement beginning, I think, what was that, December 8th. We ticked up to 111. And then again on December 21st, we hit 112. And then just last week, we hit 113. And so I have to say, I think this is a testament, I know it is, to our high vaccination rate here in the county. So it's showing that the vaccines are effective and they are coming through on one of the things that they promised. Not severe illness, low chance of hospitalization, and absolutely a lower chance of death. So kudos to the Orange County community for our vaccination rate. We can see that it is not, it is working and we're not seeing a lot of deaths. So this slide, and as soon as we put one of these slide decks together, it's already old as soon as you hit save. But this was from the surveillance report that came out from the state last Thursday. So they update that report once a week, so only on Thursdays. But this slide I wanted to share just so you could get an idea of what we're seeing, what variant we're starting to see in the community. And so again, this shows where the Omicron variant was first detected in North Carolina the week ending December 11th. So for the week ending December 25th, it was believed that the Omicron variant represented about 40% of our sequenced viruses. I know that number is far greater. There's always a lag in the sequencing. I want to say maybe about 4 weeks. But here, this last report from last week, we saw it was about 40%. I think we're closer to about 85, 90% now, with that being Omicron. However, this will show you that in addition to Omicron, we still have a good amount of Delta also circulating in the community. So just a few things that we know about the Omicron variant. One, we know it is highly transmissible. Some believe it is at least 2 to 3 times more contagious than the Delta variant. So recall this fall, we got Delta and we thought, oh my gosh, this is even more transmissible than the other variants we had seen. And then Omicron visits us for Thanksgiving. It is rapidly spreading. Here in the southeastern part of the US, our region, again, it's showing that about 95% of the cases that we're currently seeing. Preliminary data suggests that it is less severe, so it affects the upper respiratory tract. So folks are showing the symptoms that result in congestion and stuff like your nose and your throat, more than the lower respiratory tract and the lungs, which we were seeing with the Delta variant and others. Impact on the vaccines and therapeutics. So there's some decreased protection from your primary series of vaccine or past infections. So this is when they talk about it can evade the vaccine or past infection, that immunity that one tends to get. Boosters have been shown to provide increased protection. So the booster restores the vaccine effectiveness against infection to about 75%, and the boosters reduce your risk of hospitalization by 81%. So again, I can tell the Orange County community is showing out, and we're getting our vaccines and our boosters because we can tell it with our hospitalization of Orange County residents and the death numbers. But Omicron is also showing some decreased protection from some of the therapeutics. Early studies are showing that maybe there's some decreased effectiveness of the monoclonal antibodies. And it seems like just as we got a system in place and folks will get a positive result, meet the criteria, we were getting them the antibodies. But now that's not showing to be quite as effective. And I am not gonna embarrass myself and trip all over the rest of these antivirals, but they are here in the slide, which I will make available for you all. But some of the other antivirals still appear to be somewhat effective. So I just want to spend a little time bragging and showing how well we're doing with our vaccination rate. To date, we are still the leading county across the state with our vaccination rate. So this was as of today. I pulled this from the state site. We are sitting at 75% of our population, our eligible population, being fully vaccinated, and then 78% having at least their one dose. So these are folks that we will continue to reach out, hammer, and encourage them to go complete their series, and then when eligible, get their booster. So this slide shows our vaccination breakdown by race. And so just if those are interested, but I think we've done a good job in reaching out to all communities equally. Some uptake a little better, stronger in, with some populations than others. But again, we do still have a very high vaccination rate for the county. Here again, ethnicity. Early on, we know we did a lot of work around equity and we wanted to make sure that we were making the vaccine accessible to everyone in our community. So I was very pleased to see these numbers. We are reaching our Hispanic population, 72% fully vaccinated, and everyone else, non-Hispanic, 67%. And then here's the breakdown by age for who we have vaccinated. So still a little work that we can do in some of the age categories. Pretty good turnout for our 5 to 11-year-old group. That was the last group to become eligible, but we still absolutely want to see that number increase. So we continue to do some outreach and work with both of the school districts and the private schools to make vaccine available to that age group. Our 12 to 17-year-olds, they received eligibility a little sooner, and so we'll see they're sitting at 75%. 18 to 24-year-old is 52%. I would say this is not maybe a true representation of the vaccination rate of all the 18 to 24-year-olds in our community. Just like when you have a positive case, it is attributed to your home county of residence. So UNC, they have done a good job tracking the vaccination status of many of their students. And so I know that number probably is a little bit higher. However, if students are using their home address, then it's not being attributed to Orange County because it's not their county of residence. Anticipated changes to some of the county mitigation strategies. And so just as I was preparing for this, I know there was a big announcement coming out of Durham County this afternoon at 3. I did not get to hear what that is, but I will say in my conversations with our elected officials at this time, they have not conveyed any plans to implement any gathering limitations, curfew hours, business closures, etc. Some things that I know they will continue to recommend is the masking. We know the masks, they absolutely work. Lots of conversation over the last few weeks about what type of mask you should wear. But the takeaway message is you should have on a mask if you are going to be in an indoor space in public. Vaccination and boosters, we will continue to push that because we know they are effective and they work. We'll also encourage folks to do as much physical distancing as they can when out in public places, and hand hygiene. Tried and true, that's one of the things that has been with us since the beginning of time in public health. So we will continue to recommend these mitigation strategies to slow the spread. Testing, testing, testing. Whew. So testing has been a challenge for us, but not only for us here in Orange County, it is a challenge right now for everyone across the state. It is strongly recommended if you have symptoms because a positive test result could lead to different treatment options for you. So if you are sick and having symptoms, absolutely would encourage you to get a test if you can. It's recommended if you have a known exposure to a positive COVID case. And that's just so you know your status. Very similar to how we used to talk about HIV when it first came out. You want to know your status so you move and behave in a way that protects others around you. And then for some, it's still required for employers, if you're unvaccinated, that you do the weekly surveillance testing. So I wouldn't dare talk about testing and not give you some ideas about some resources because I know it is really hard to get testing right now. So when you think about testing, I just want to make sure that everybody understands it is okay for you to test outside of Orange County. We are slammed here and there are long wait lines and it's days out before you can get an appointment at many of our resources here locally. Whenever you get a test, if you're outside of Orange County, don't worry because the results will be reported to the local health department in which your county of residence is. So whatever you put on your paperwork as your address, they will report the results to that local health department. Statewide reports delays for the results. So again, I know some communication went out today from one of our contracted vendors from the state, StarMed. They sent out notification and letters, and we are posting it on our site and pushing it out on our platforms. But there's been a delay, and I think the demand across the country for testing, all in this one short time frame, has really jammed up the system, and so there is a really long delay. Last time I checked in with the team, I think it was taking close to 5 to 7 days for folks to get their results. So I am hoping that we hit this peak sooner rather than later and things kind of get back to a normal kind of demand here for us. NCDHHS has announced and launched on their site at-home test kits. And so I've included the link here. And again, I will share the slides with Aaron so he can push it out. But there's an option for you to go onto their site and make a request to receive a test kit, mail it to your address. It comes with the instructions on how to do the test and then how to submit your results to the lab. So one of the questions that has come up is when you get your lab results, do you have to then call the local health department to report it? Very good question. And I will be honest, because I'm thinking about the true capacity of our team. So I don't remember right off what lab processes the results, but the labs were generally doing electronic reporting of those results in their system. So I don't believe at this time that it's required for you all to call and give us your results. And honestly, I don't know that I have staff members that would be able to answer the call and record and keep up with your results.
Quintana, let me ask it. Matt, yeah. You and I have spoken about this. The DHHS, they send you one, you put it in your nose, you then send it back to them. They then take 5 days to process it, then they tell you. That doesn't sound much better.
Right.
The at-home ones where you stick it up your nose and it's like a pregnancy test and you sit and you wait and you worry for 15 minutes and it has 2 lines on it. Those are positive. Are folks supposed to call and tell you?
So for those, I would say yes, please do call and let us know. But like you made a good point yesterday, in addition to the positive, we would love to know the negative, but priority, we want to know the positive so we can ensure that you're getting the right guidance and instruction on how to isolate and things that you need to do. But as we know, the more tests that we have, if we have that denominator is a little larger and they're negative, that percent positive starts to come down. So
Back
yes.
to testing, because this has had a lot of questions on this. You were saying that unless you are symptomatic, you really are, in order to speed this up for those that are symptomatic, they need to know that if you are not symptomatic, you should not stand in line at either in Chapel Hill or in Orange County and get a test just to go see grandma.
So that would be my recommendation as of today. But again, as the supply chain and the workforce comes back and folks are able, to really run at full speed. I know with one of our vendors in the Hillsborough area, they are really strapped. They just have lots of staff that are calling out because they are experiencing COVID themselves or having to stay home and care for a household member with COVID. So I'm just asking that just for this short time frame, maybe we prioritize and allow folks that are sick to get priority of getting those tests and getting their results, because again, that could impact some treatment options that they would have.
With our next speaker, we're going to ask a little bit more about incubation periods and other things, right? Because if by the time it's 7 days, you might have already gone through it. So we'll talk in a minute about how COVID is operating different in the human body.
Yep.
And some new rules. Can you, thank you for the testing resources. For me, I Googled North Carolina, Orange County testing, and the health department's got 2 great links. In a recent email the Chamber sent out to you, you also see a host of links, and then here's some resources for private providers. Yeah.
And again, this information changes often. So I'd always say go to their specific site or call the numbers to get if they have new criteria and find out if they require appointments. So the other big thing that happened, an after Christmas gift, CDC changed, they shortened the isolation and quarantine guidance. So I do want to talk about that for a few minutes because I'm sure there are lots of questions. In the very beginning, our isolation quarantine timeframe was 14 days. But the more we learn about, the COVID virus and as we go along, we were learning, okay, maybe it is okay to shorten that. So then we backed off and it was 10 days. And now, as of the 27th, 28th, CDC announced we're down to 5 days. So here's some of the guidance around the new shortened isolation and quarantine timeframes for a COVID positive result or being exposed to a positive case. Now, we'll go ahead and say that this guidance was intended for the general population only. The K-12 school population, they have some similar guidance, but when you think about places such as some of our high-risk congregate areas, CDC is telling us it's coming, but we're updating, working on that guidance as well. So that would include like some of our homeless shelters, a correction facility, those are long-term care facilities. They will have a separate set of guidelines to go by. And it's no guarantee that those numbers for their time will be shortened. Same thing with our child care centers, and especially for the child care centers. I mean, I've heard from quite a few spirited parents this week, and I get it, it's frustrating because you can have a school-age kid who has this set number of days to isolate, quarantine, then you have a younger child in child care, and you're told, well, they got to do the full 14 days. But the thing I would say we have to remember, the thing we have to remember is that is the population that still is not eligible for vaccination. So they are high risk and more susceptible to contracting the virus. So the first guideline here, if you test positive for COVID-19, regardless of your vaccination status, you are asked to stay home for 5 days. If you have no symptoms or your symptoms have resolved, most notably your fever is gone, at least 24 hours without use of any medication, they want you to continue to wear a mask, but you may go out day 6. You may return to work or return to school. However, it is so important, and these shortened guidelines only work if we really stick to the masking criteria here, but continue to wear a well-fitted mask around others for 5 additional days.
Quintana, will you share, it is 5 days from your symptom, not 5 days from your positive test, correct?
Correct. So your day count starts at onset of symptoms.
So you get a
That's
sore throat on Monday, you worry about it on Tuesday, on Wednesday you get a test, it's positive. You're good to go 5 days after Monday, right? You're
correct.
to re-enter wearing a mask and can go back to work 5 days after first symptom and 24 hours after last symptom. Is that it?
Yeah, so really what they're talking about is the fever. So if that fever is resolved and you're on the mend without the use of medication, then they feel like it's okay for you to go out.
Okay.
So if you were exposed to someone with COVID-19, and this is where you have some, I guess, exemptions, if you will. So say you've been exposed to someone with COVID, tested positive for COVID-19. If you have been boosted, meaning you've completed your primary series of Pfizer or Moderna within the last 6 months, or you completed your primary series of the J&J within the last 2 months, then you don't have to quarantine. But we are asking that you remember to wear your mask around others for 10 days. If possible, test on day 5, just so you can get clear status about your condition. Find out for sure if you have it. Again, I understand that's a challenge right now with our testing resources, but if possible, they want you to test on day 5. If you develop symptoms anytime during this 10 days, that's a game changer. You need to stay home and quarantine. And again, start your count at the onset of symptoms.
Got it. We are gonna, do you have much more? I'm gonna pivot to Dr. Mehrotra and then come back to you for more, but let's wrap yours up.
Yeah, we can wrap this one up. And so the last big piece of guidance, if you were exposed to someone with COVID-19, but say you completed your primary series longer than 6 months ago, you're not boosted, or you were never vaccinated, then you would need to do the 5-day quarantine. And if no symptoms or they're resolved, then the 5 additional days of masking. All right. And then that's it. I think my last slide was the ask of the businesses. And I say, please continue to promote safe environments that protect all. Encourage your sick employees to stay home. Continue to encourage vaccination and boosters. And then call the health department if you need more signage or if you have questions about any of your workplace cases.
Thank you, Director Stewart. Y'all, we have incredible influence over our employees, both to share good practices, to share this information out to them, to encourage their good behavior and to encourage their vaccination. As you guys have seen the graphs, it is off the chart. I'm just gonna, this is from the state of North Carolina today. This is Orange County, just to show you these things in terms of scale with each other. If you all are able to see this dashboard, this was when the students first moved back, and we closed a university when we were at that kind of rates. And then this is what was being described by Director Stewart. It is a tremendous increase. This is before the student positivity rate gets added. We are going to add 1,000 more, maybe a day, to this number, which will dwarf what we had before. So let's talk a little bit on the medical side of things. Let me stop my sharing and give me a second, guys. We'll all come back together and introduce our next speaker. We are very fortunate to have with us UNC Health's Dr. Abhi Mehrotra. I gave a good introduction of him earlier. We appreciate he is seeing this firsthand in the emergency departments at UNC's Health's Hillsborough Hospital and in the Chapel Hill Hospital. We're grateful to have you with us, Dr. Mehrotra. We're hoping that you can answer some questions for us about what you're seeing as a state of COVID in our healthcare setting, and then what may be different about this Omicron variant. Welcome, we're very glad to have you.
Thank you, Aaron, and good afternoon, everyone. I'll be brief. I've got some data to share with you. No slides, so this will be a conversational, and be happy to answer questions as we go. Just to give you some background on where things are right now, from a UNC Health, the entire system perspective, not just the medical center. There's currently about 640 patients that are hospitalized with COVID. As Dr. Stewart said, we've seen the test positivity rate kind of tick up. Back in mid to late November, we were seeing around the 12% positivity rate, and we're currently at about 36% positive across our entire system. That varies from site to site. At the medical center, for those patients that are arriving that are symptomatic and we test them, we're at right around that 30-35% rate. At the Hillsborough Hospital, for those patients that are symptomatic, we're higher than that at around the 45% positivity rate. So it varies from site to site, but we are seeing a significant uptick in positivity rates of those patients arriving, tested, that are symptomatic. Similarly, we're seeing kind of a twofold distribution here. Those patients that are arriving and admitted to the hospital that are symptomatic with COVID, that's about 80% of the COVID positive numbers that you're seeing. About 20% is patients that are arriving seeking care, and oh, by the way, I'm found to be positive for COVID. So the COVID numbers we're trying to split those out to be a little more discrete and segregate about who's coming in with what. So if you're admitted with COVID-related disease, if you're short of breath or have something COVID-related, we count you in that 80% versus that 20% that you may have fractured your leg. And we do an asymptomatic screen to sort out for that admission, and that patient turns out to be positive. So that's the kind of split there. Specifically at the UNC Medical Center in Chapel Hill, right now there's about 150 patients hospitalized with COVID. So significant numbers of patients coming in. What's different about this surge compared to what we're seeing previously with Delta and others was much more of an ICU concentration. Those patients were really sick and had respiratory problems, had difficulty breathing, were in the ICU, were on ventilators. It's slightly less than that in terms of concentration of ICU patients, many more patients being admitted to what we call a floor bed. So they don't need that high intensity nursing, but they still need to be admitted to the hospital. They need oxygen therapy. They need to be closely monitored. And so a much more significant pressure on the number of patients arriving that need floor beds into the hospital. As was mentioned earlier, the importance of vaccination of those patients that are on ventilators. Right now, about 85% of those are unvaccinated. So only about 15% of those patients on ventilators are vaccinated. Now that also takes into account the patients that may be vaccinated, but their immune system hasn't responded. They're on immunosuppressive agents, they're a cancer patient, et cetera. So that's a little bit of a nuance in that number. As Director Stewart was saying, we've seen a rapid change in terms of the sequencing, and even more up to date. We've been able to pull some data. I just got this right before this call, about 87% Omicron now compared to Delta, just as you thought. So, and there was a pretty rapid change right at the end of December where we saw much more Omicron instead of Delta, and that's been pretty quick. And that leads to, similarly, as Dr. Stewart said, the available therapeutics have changed. So the monoclonal antibodies that we were able to provide before had much more effectiveness against Delta and much less so against Omicron. The only one that's really effective against Omicron is the Cetrivimab. I've stumbled on it just like you were planning on. So the Cetrivimab is the only one that's effective and is in currently very limited supply. There are some oral and therapeutics available, but those are, again, in very limited supply. Things that we're concerned about right now, just as our businesses are, is the COVID-related absences. We're seeing a lot of that within our workforce as well, in support staff, nursing staff, physician, and APP staff as well. Across UNC Health, I think as of this morning, there were about 1,000 COVID-related absences. And so our occupational health folks are also working diligently to try and bring bring workers back in after clearing them through the occupational health process. We have seen a reduction because of that volume of patients arriving in our non-urgent procedures, and that has ramped down to provide capacity to be able to take care of COVID-related patients coming into our hospitals. We've seen that in health systems across the region as well. As was mentioned, just like in the community, testing is a concern for us as well. You may have noted our Respiratory Diagnostic Center has ramped down the ability to provide asymptomatic testing in order to provide the prioritization for symptomatic testing. So testing for travel purposes, for return to work purposes is going to be reduced in priority at the RDC, and will refer folks to the community sites as best as possible to reserve that testing capacity for patients that are symptomatic coming through. In terms of what we're worried about, it's the next 3 to 4 weeks. As Aaron showed, the rapid uptick in the utilization and the number of patients that, what we're seeing with Omicron, while the common theme is that it is less severe, it is still severe enough that many patients are seeking care. And if that denominator gets so big of those patients seeking care, that can overwhelm the system. And so that's kind of where we are right now, with significant wait times for those seeking care. And so it may not matter if you have an appendicitis. If there's no capacity in the system for you to be seen, the wait times are significant and impact your appendicitis, even though you're not COVID related in terms of the seeking care. A couple of other things to carry forward is, as was already mentioned, if you're symptomatic and have a positive home antigen test, I don't know that there's a need for a confirmatory test. If you're symptomatic with a positive home antigen test, that's positive. And we would recommend that you call the health department if need be, but also go ahead and count that as a positive. There's no need for a confirmatory PCR test. That's a positive in our books. Those antigen-based tests, especially in light of symptoms, are quite accurate, and we rely upon that as well. And then you may have seen some messaging going out from UNC Health, as well as other health systems across the region, about utilization of the emergency department and hospital resources. And this is really one of those times where we have to work together as a community. Come seek care if you need it, but if there are other avenues to seek care, be it through telehealth, be it through urgent care, be it through your primary care office, try those avenues so that the emergency department can be reserved for those patients that need the acute care evaluation. I'll stop there with that data kind of presentation and be happy to take questions and answers. Yeah.
Let me ask a few questions. One, if you do need urgent care, if you do need emergency care, do you all have a recommendation? You'd rather us make a go at Hillsborough or drive on down to Chatham versus come to the main hospital in Chapel Hill?
So I'd say if you need emergency care, go to your closest ED. And whichever that is, we don't want to delay emergency care. The caveat there being, right now with the hospitals that are so full across the region, not just in our area, if you need specialized care, go to that facility that specialty is. So for instance, you may not have at Chatham an ear, nose, and throat doctor. This is just an example. And if you have a specialized post-operative issue from an ear, nose, and throat person, seek care where you know that the availability is.
Let me ask about Omicron, and it seems to be that the symptoms come faster and it resolves faster. Can you tell us a little bit about, if you do have it, what the expected, here it's 3 days and then resolved in 3 days? Is that what folks should expect?
Aaron, great question. And I think this goes back to what Director Stewart was saying with the CDC's recommendation. Some of the science behind why reducing to 5 days is that you're infective much sooner, and you get over that infectivity phase much sooner as well. So that's some of the science behind going down to 5 days for the isolation and quarantine guidelines.
So often we'll get asked by folks if they were in close contact and it's now 5 days later, you should feel pretty good. Is that right? That if there are symptoms, they should be within that early period.
Right. I think 3 to 5 days after exposure, you should have onset of symptoms if you were to be positive.
Let's turn to some of the questions. That was incredibly helpful, and I really appreciate that. Jackie, thank you for posting from Durham Tech that you all have testing available on your campus Monday through Friday, open to the public. And there is a link there. Dr. Fowler, who is a pediatrician as well as a county commissioner, asked how contact tracing is going with the uptick in positives. Are you guys changing your approach at all in terms of contact tracing? Director Stewart?
Yes, and hi, Dr. Fowler. I think I saw an email in my inbox from you. So yes, we have changed our contact tracing process. And so with this surge and this uptick, the state felt, and we absolutely know it locally, there was no way we're going to be able to keep up. So it has gone to a more passive approach where folks will just get the digital text as the first notification of what they need to do. They also had a glitch in the system the last week in December that they had to work through. So there was a significant delay in getting folks notified who had positive results. So there was a delay, and you're right, by the time folks even received their result, they had already completed probably the first 5 to 7 days after testing.
I also ask you, Director Stewart, there was a question about, do you know the booster rates amongst Orange County? And I'll expand on that. Do you expect we will change the definition of fully vaccinated? Fully vaccinated still means one of the J&Js and 2 of the others, right?
Correct. So I know DHHS is working on being able to pull out and determine our numbers for boosting. Right now, it's hard for them to figure that out in the CVMS system. That's the COVID vaccine management system that we use at the state. So right now, when you look in, they can't differentiate between a third dose that many of the immunocompromised folks receive versus a booster. So they got to figure out how to change that in the system so they can pull that report. As far as do I expect there to be a change in the definition of fully vaccinated? Yes, probably coming. I think the language that I hear CDC using on recent calls is being up to date on your COVID vaccination. So I think they're going to use the term up to date as opposed to fully vaccinated, because when they made the changes to the isolation and quarantine guidance and they gave these criteria, that would consider you fully vaccinated or up to date, they included the booster. So I think we're all just waiting for the CDC to make their official change, but they kind of already made the change when they made the change in the isolation and quarantine guidance. So I do anticipate that will come. And again, I think the term we'll see is up to date on COVID vaccinations and not fully vaccinated.
So let me ask that y'all business folk out there. We know that Duke University has already said they will require boosting amongst their employees. For those of you like here at the chamber that have a requirement for folks to be fully vaccinated in order to work here or fully vaccinated to participate, it's a good time to be thinking about how you might change your language. Dr. Mehrotra, there's a question about a projected timeline for the decline in the spike. Do you expect we'll behave a lot like South Africa? And if so, we're taking this rocket ship to the moon, but we're also coming back from the moon quick. Can you tell us what you think? And then Council Member Barry, I'm going to call on you to ask your question if you'd be ready to unmute yourself. Dr. Mehrotra.
Yeah, so that's a really good question, and it's hard to project. Will we be similar to what happened in South Africa with a very rapid spike and a very rapid return with not much of a change in the death rate? They had a high infection rate and then a high hospitalization rate as well. We've done some projections. We've had some internally to UNC Health looking at this and followed it over time. The hospitalizations that we're projecting with this spike significantly increased compared to prior spikes that we've seen. The best that we have is looking at somewhere around mid-March to be the kind of high point, early to mid-March as the high point of this. So we still have some time to go. Again, that's projection, and it's only as good as the assumptions that are mathematically put into it. But that's what we're seeing as the best guess that we have right now.
I'm going to guess that your modeling does not anticipate 30,000 student return. So I'm going to imagine there's a little bit of something different going to happen in ours, but it's still, I'm glad to hear you say come back quickly. Director Stewart, so Dr. Hamlet, our superintendent, posted a note in there which wants begs me to ask you, is it possible that you will suspend contact tracing? That this will be, that we're just not gonna do it, or that you'll relieve organizations like hers of having to do it?
So thank you, Dr. Hamlet. Great question. And I should have prefaced my response with that caveat. So per DHHS guidance, yes, we are relaxing it for our general population. However, we, even at the health department, we are still having to do the contact tracing and the full case investigation for like our congregate sites, long-term care facilities. And at the moment, schools are still in that group where they consider it high risk. So if you have outbreaks or cases in the workplace, we will still come in and do a full investigation and some contact tracing for those groups. But for general population and just the positive results that we get, we have relaxed that contact tracing.
Excellent. Y'all, as employers, you can really help them out by keeping up with it internally and not relying on them to do it. Keep track of who is working with who, so you can help spread that word. And remember that if they are vaccinated, they do not need to quarantine. Council Member Berry, are you able to unmute yourself and ask your question? And it's exciting for me to, my first time introducing you as Council Member Berry.
Thank you, Aaron. It's exciting for me to be introduced that way. Yes. I first want to thank you, Aaron, for you and your team bringing these two experts in our community to talk with us and share with us. This is very helpful. My questions are, what are the recommendations for those who were fully vaccinated but not boosted before contracting COVID? I know of many people, myself included, who contracted it during this surge. When should an individual pursue getting their booster?
Great question. Dr. Mehrotra.
So great question, and have had that opportunity to answer that for recently as well. And the latest guidance that we have is there's no delay. Up to 2 weeks after the infection, you can go ahead and get your booster, is what we're recommending to our patients. So if you've been vaccinated and prior to obtaining your booster, contract a COVID infection, 2 weeks after that, you're eligible to go ahead and get your booster shot.
So you said can. I'm going to ask you the should question. So you said it can, 2 weeks. How about should?
In my view, I would get the booster as soon as is possible.
Got it. So 2 weeks after resolution of infection, then you can get boosted after COVID. Yes?
Correct.
Perfect. Councilmember, did you have a second question?
Well, that was the two questions. What should happen, and then when should a person do that? And this is excellent. I went into Tar Heel Pharmacy today to get some N95s. And I know that they are giving both the Moderna and the Pfizer vaccinations. And it's important to me, I think from what I've heard, to try to get a mix. I've been vaccinated the first and second time with Moderna. And so now I'm looking to get the Pfizer. Is that, okay, so there's another question. Is that your recommendation, doctor, that we try when possible to do a mix?
I think that the recommendation is the one that's available to you is the best one. And where our official stance is, if you had the J&J first, if you can get an mRNA vaccine, be it the Pfizer or the Moderna, there's no real preference if you had the Pfizer or Moderna to go with one or the other in terms of our official recommendations from UNC Health.
Fascinating. Jennifer Player, the director of our Habitat for Humanity Orange County, is on the call. She had a question. Jennifer, can you unmute and ask it?
Sure. Yeah, my question is about what I'm seeing and hearing anecdotally throughout the community is that a number of people have Omicron and they're really asymptomatic, or maybe it feels more like a cold. So I'm just curious what the recommendation is for someone who is asymptomatic and may have been exposed.
So Director Stewart, do you want to talk about the recommendations in terms of the exposure and isolation and quarantine, and then I can talk about the asymptomatic piece?
Sure. So I would say, and this kind of goes back to some of our general recommendations, just how we navigate in this pandemic environment. So I would say, one, if you're sick, just stay home. For me, I would rather you assume and think you have COVID and you just self-isolate for the 5 days, and then you strict adherence to the mask. So that's what I would recommend. If, of course, your symptoms get bad enough that you need to seek care, then of course seek medical care. But yeah, I think at this point, if you catch it and it's Omicron and it's mild, you think it's just a cold, I would say please just treat it as if it is COVID and self-isolate for the 5 days, and then do the strict 5-day masking to complete the 10-day period.
Before going to Dr. Mehrotra, if you are asymptomatic and you've been exposed, it's my impression from your second to last slide is you do nothing different. Asymptomatic, exposed, but vaccinated, you proceed with wearing your mask indoors and doing what you wish. And if you're a little anxious, you keep a little more distance. But there are no requirements. Dr. Mehrotra, do you want to add a medical view on that, or a physician's view?
2 quick comments on that. One, if you have symptoms and are suspicious, if you think it's a cold, that's the benefit of being able to take a home antigen test. So if you feel like you have symptoms, may have been exposed and want to know, go ahead and take that home antigen test. The second piece I'll add is, knowing that we're having difficulty with testing. I believe this weekend starts the opportunity to have testing being able to be shipped to home, and insurance companies cover those testing supplies as well, up to 8 per person per month will be starting, I believe, this weekend. And so more details should be coming in the broad media about that shortly.
It's hard to find them at stores. I'll say it this way. It has been told to me you will have more success if you travel to a community where they seem to care a little less about COVID. We'll just leave it there. You can look at a map and you can kind of tell the places that are really caring a lot and some of the places where it's a little lax. And the CVSs in some places have them, and Orange County don't seem to. We are hoping that those supplies will recharge soon. Steve Shaw, you had a question. And then I have one in the chat that's been that I will ask.
Yes, I thought I heard Dr. Mehrotra say that he expects the peak of the spike to occur in mid-March. Is that correct?
Yep, early to mid-March is what we're looking at.
And would that be peak in infections and in hospitalizations, you think?
I was looking at the peak of hospitalizations. I would anticipate that they're probably running similar.
Okay, all right, that's helpful. Thank you.
Jennifer Player posted that she checks the Walmart app. It'll tell you a daily basis. And if you all remember how you used to hustle to get toilet paper, you apply the same to this. If you get there in the very beginning of the morning, you're more likely to find those tests. We're seeing them at about $18 for a 2-pack online, and in stores, I think something similar, $8 to $10 a test. All right, the question was asked about what your recommendation, I'll go with both of you, Dr. Mehrotra first, about volunteer opportunities. If you volunteer in your church, you volunteer something that is voluntary, you don't have to be there. Is there a recommendation that in this Omicron surge and COVID surge that folks should change their habits? Should those places close? Should they limit their operations? Would you discourage people from doing it? Or masking and with all the other protocols, is it safe for them to stay open?
Yeah, I think there's a balance and the risk-benefit ratio of being involved in serving in the community, as well as protecting yourself, and what your risk factors are, whether you're immunocompromised or are taking medications that knock down your immune system. I think it's safe to be in an outdoor setting if you're around others, wearing a mask, wearing eye protection if you need it. I go to work in the hospital setting seeing COVID patients. And I wear my mask, I wear eye protection and gowning if I need it. So I think you can still carry on with activities, but do it in a safe manner.
Great response. Director Stewart, you had talked about what you projected. So we've heard about when the spike and then the return, and you said you did not anticipate any additional restrictions on who's an essential worker or on how many people can eat in a restaurant. Can you just say a little bit more about that? Are you saying that based on what you know, you do not intend to make any of those recommendations?
Yes, at this time, I do not foresee that I will make any of those recommendations, just based on the data that we collected when we were doing the heavy contact tracing and the case investigation. It was not the public places where we were seeing this behavior. Now, early on in the pandemic, before vaccination, you know, some of the bars and stuff, we would see that, but that was a different type of behavior. But what we're seeing whenever we have like these clusters, it's the social interaction and behavior that folks would have. And so sometimes that was not limited to just like in a restaurant. It was the other activities, and normally they had spent prolonged amount of time together. So I'm not seeing where there is an outbreak in a restaurant or somewhere where I would give the advice that we should, you know, close down the restaurants or do any of that nature. I don't, you know, I'm a public health person, so not business, not economy, but I wouldn't want to invoke more strain and hardship on our community. And folks, you know, I think we have to learn how to live with COVID. It feels like this is going to be here with us. So how do we just change up some of our behavior and figure out how to function and do it in a safe way? So yeah, I don't have any recommendations to restrict anything at the moment.
It does sort of feel like, and when you and I spoke yesterday, it's like the first wave we hid from. We restricted our movement, we stayed at home, we put in curfews, we were avoiding it, we were washing our food with alcohol. In the second one, we protected ourselves from and vaccinated, and we did our best, and we still had great restrictions. This one feels like you can't hide from it, and you'll do your best to protect from it. We're just have to endure it. When does something go from pandemic to endemic? When is this, Dr. Mehrotra, is this with us?
Well, so that's a great question. I don't know that I have a great answer to it. You know, the ideal is that we get past this before another variant arrives and becomes even, you know, as deadly and as infectious as some of the others that we've seen in a combination form. I think, you know, the comment that you made, Aaron, about having to live with it. Well, you know, the idea is also, we talked very early on about flattening the curve. We've done the opposite of flattening the curve with this wave, and it's the problem being it's getting ready to overwhelm the healthcare system. We may be done with COVID, but it's not quite done with us just yet.
Well, let us all do our part and keep our hospital system as functional and successful as it has been for our community for decades and decades. And again, heed their request. If you do not need to go to that emergency room, do not. Think about what your other options are. Find other places to do your testing. Consider what it is you need and who you need it from. And Director Stewart has given us good advice. Because of her good work and our community's compliance, we flattened the curve long enough for us to get our vaccinations, and so that we don't have to lock down. There are some places in the state and others where they should be locking down, right? But we don't need to, I think. And you've said that very well because of our successful vaccination rates. Any final comments from either of the two of you? Any sort of parting words that you want to offer? Richard White has asked to the group if anybody does know what Durham said. Everybody's fast on the Google, but I'll let Director Stewart, you go first.
Sure, thank you. So one, I just want to say thank you to the Orange County community. Again, I appreciate you all trusting us and following some of our recommendations early on about being vaccinated. So now I would just say, please go get your boosters. As I stated earlier, they show to be effective and they help and they work. So let's just stay the course and vaccinate, get your boosters, and keep that mask with you. It works. So let's just continue to protect each other.
Fabulous. Thank you very much, Director Stewart. Dr. Mehrotra, we're so grateful you joined us today. Any final words?
Yeah, I'll just echo what Director Stewart said is thank you, first of all, to the community for supporting us. The healthcare workers and along with the public health workers are fatigued, just as everyone else is. And we're working hard to try and take care of our communities. I think you can demonstrate that support by wearing your mask. by getting your booster. And as was just recently approved, get your teenage kids boosted as well. That has just been approved, so please go do that. And let's work together to see if we can't move beyond this.
We're grateful for our partnership with UNC Health and that you all were able to join us today. We're grateful for our partnership with Orange County, in particular with the Health Department, Director Stewart, thank you for your leadership. Hey, for the rest of you all, your Chamber of Commerce is here to help you however we can. Please reach out to us by email, in person, or text, however. And if there's anything we can do to help you solve these problems, connect you to resources, we hope that you will rely on us for that. We are grateful for your membership and your partnership. And to the community leaders, I see the sheriff has been with us today on this call, many elected officials and business leaders. We're working well together as a community, and let's keep it up. With that, we will adjourn today's call.